Hey everyone, I'm Michael Uriarte or Dr. Mike, and welcome to Technique Talk, the MYK System and More. This is episode 44 in our series, and today we're going to interview Vivien Henderson about craniosacral therapy. I contacted Upledger Institute International to see if anybody wanted to talk about their system. They put me on hold, and in about 2 minutes, they came back and said, "You gotta talk to Vivien." What a great compliment to her. And you'll see she does a fantastic job of explaining what to expect when you go get a treatment, how to navigate the courses, and even the process to become an instructor. If you want to learn more about craniosacral therapy, you're going to get it right here. If you want more information about Vivien or the Upledger Institute International, I have the website links in the description below, as well as a link to a page on John Upledger to learn more about him, and also a link to their research page. So you can go in and you can search different conditions and you can find case studies and research articles on how craniosacral has helped with these conditions. Hey, if you haven't subscribed, be sure and hit the subscribe button. I have a lot more videos or interviews coming. Whether you're a patient looking to get help or a practitioner looking for a good technique to learn, this series is what you need. Let's dive in. So, Vivien, tell me what originally got you into healthcare?
Okay, well, when I came to America, obviously from the UK, I got married, I settled down, and I decided that I wanted to do something completely different to what I was doing, which was retail, fashion retail store managing, and very, very different to what I do now. So I looked around at the colleges and I saw massage therapy, and I looked at what it entailed, and I said, you know what? That's something I could do that I could eventually run my own business and be flexible, to have children and live, right? So I went to massage school. And as soon as I got there, I was like, this is definitely something I can do. And there was an instructor that did a talk on craniosacral therapy. And that's I'm kind of moving on to the next question here. Well, how did I get into craniosacral therapy? But that's what happened. I enjoyed massage therapy. I had the talk on cranial, it was just a little lunchtime lecture. And I just got so much out of it. And hearing about Dr. John, how he used to work with children with autism. And I have two nephews back home that are both on the spectrum. So I was like, I think I need to hear more information about this. So I did. I went to the institute. They had a introductory class, which I still think they do now, as a student. And I went and I was like, I just wanted more and more and more. It was just so interesting. And I was like, I've got to know this. And 16 years later, I'm still learning and still practicing. So that's how I got into healthcare, and that's how I was introduced to craniosacral therapy.
So then let's go back just for a second. So you came over from, you
Yeah,
came across the pond, as they
across the
say, right?
pond.
Across the
Yes.
pond. And so when was that? That was roughly, you said about 15, 16 years ago, or was that before that?
Yes. 2006. Yeah.
2006.
hmm
Okay. And so came over here because you got married? You got married and came
I
over?
met I met my husband and my now husband. I was here on a trip previously, and I met
What
some
a neat
family I've
little
never met
story.
before. I know that's a whole episode, that one. And
Very
yeah,
good.
I met him on a trip, and then the next year we got married, and it was like, okay, let's, and it was meant to be. There was no questions or doubts or anything like that.
Oh no,
You know,
that's cool. That's cool.
it's just been the best thing.
So you were doing something else over there. You were doing a different
Yes.
profession. You came over here and said, "Okay, what am I going to do?"
Yep.
And so you looked at massage therapy
Yep.
and got into that. Now, so you were in Florida. You moved to Florida. Is that
I moved to West Palm Beach, where I am
West Palm
now.
Beach? Oh, you did. Okay, so you've
hmm
been in the same spot the whole time.
Yes.
So
Yes.
where is
Yes.
the Upledger Institute? Is it in
That
that?
is in that is in Palm Beach Gardens, Florida. So that's a bit north from West Palm Beach, maybe about 20 minutes north.
Okay. So
Yeah,
you were
not too
close
far
to it.
away.
You were close.
Yeah, I think I was meant to be there, a student.
That's good. That's good. So a question I have
Yeah.
is if you were to explain craniosacral therapy to someone who knows nothing about it, like, okay,
hmm
if I come in to get a craniosacral treatment,
hmm
what would that look like? What would that entail?
What would that look like? Well, firstly, I would welcome you into my room, my therapy room, which is so comfortable, and you would just feel right at home when you walk in. I will ask you a few questions. You will have already filled in a small intake form anyway for the appointment. And I will then do some evaluations. And you're going to tell me, why you've come. It could be a painful shoulder, headache. Um, Whatever the reason is, I always start with an evaluation, and I will feel for any fascial restrictions in the body, look at the craniosacral rhythm from head to toe. There's a lot of techniques where the body can show us exactly how we need to begin the session and work the session.
Is the person on the table at this point? Are they
Yes.
okay? So they're on the table, and that's how you're doing the eval.
Yeah,
Is
we do the
they're on the
eval.
table?
Well,
Okay,
the eval was written first, and then a hands-on evaluation
hands-on
is when they're
evaluation.
on the table. Yes,
Right. Okay.
and
Okay.
yeah, and that's when we begin. And generally, most people are kind of quiet, which is fine. You don't have to speak in a session, but quite often, what happens is I might get to an area where there's some tissue that's, say, I'm on the thoracic area and there's some tissue releasing going on. I can feel what's happening, but the client, sometimes they're not connected to that, which is okay as well. But sometimes they are, and they say, wow, what was that? I'm feeling something. And we are trained in somato emotional release to help the person to process what it is they're feeling. I will ask them, what does it feel like? And they'll be like, wow, it just feels really hot. Oh, yeah, how hot? And, we're not psychologists or anything like that, but there is actually a lot of information that comes up from the person's body that makes them aware that something's happening. And quite often, they go down a path of where that came from.
So they'll
But
be able to go
yeah,
back sometimes to an emotional event or a traumatic
yeah,
event.
yeah. Sometimes it's just physical issue, but quite often, something comes up, and it could have been from their childhood where they fell off a tree when they were 5, and they forgot all about it until they felt that, because it felt the same way as it did back then. And I think that's really important. Rather than me saying to them, oh, I think this is what's going on, they themselves are like connecting with what's going on. And that actually helps restrictions in the body release a bit deeper, in my opinion. So
It,
yeah, so
it
it's
helps them
yeah.
get rid of that issue, right? And
Yeah,
then they can move past
yeah.
it, and then you can find something else or work on something.
Right. It's like different layers of restriction that come up and then release. They process it and then on to the next. It's kind of how it is. I will say though that some people with, say, for instance, a lot of trauma, past trauma, it can take a little bit longer. Some people it may take 4 to 6 sessions or more. It just depends. Everybody's very, very different in what their body's presenting each time.
Okay. And I was doing some reading, and it said that the pressure on some of this work is it's not real deep. It said like the pressure of a nickel, or the weight of a
Yes,
nickel. So it's
yes,
light.
it is light, but it actually, because it's light, it allows you to get even deeper
I,
into some deeper layers. Because as a massage therapist, I started off with the elbow in and do deep tissue, and
right.
that was all great. But after a while, it was like, this is not help. It might feel better for a moment, but next week you're coming back with the same restrictions, because if the muscles are tight, the tissue's tight, and it's actually from a structural issue, then you've only helped with that, the muscular area that's giving you pain right now. If the structure hasn't changed, you're going to get the same thing the next week,
It's going to go
So
back. Exactly.
yeah, and also when you do a lot of deep pressure, what happens is the body just goes like this and tightens up, and you just can't get. So yeah, it's kind of why I moved forward into cranial a lot more now, than massage therapy for myself.
So with craniosacral work, my thought process, because of the name craniosacral,
Yes,
I was thinking most of the work would be, up in the neck and then down on the hips or whatever, and that would be most of the work. But it sounds like you were saying that you can get in and find the restrictions in the thoracic area or different areas, so you're
it's
working full body.
it's a whole body approach. Absolutely, it is.
That's
And I can give you a quick example. I knew there was a reason why I placed my bones right here. I don't normally go there, but for some reason I put them there. So for instance, you've got the occipital cranial base, right? It's at the back of the head. And then you've got the sacrum bone, see the tailbone and the sacrum, okay? And when we're feeling the craniosacral rhythms, what happens is they're supposed to move in a flexion and extension movement. And these two in particular, they're supposed to move together. So if somebody does have, I don't know, an injury where they fell on their tailbone, right? And when we evaluate, what sometimes we feel is the sacrum bone might just, I'm going to exaggerate the movement to say this is
sure,
flexion and extension, right?
sure, sure.
So what we feel is that sacrum bone won't have much movement. This will have the movement, the occipital base, and the sacrum might just have a little or not move at all in the evaluation. So when we go through the craniosacral techniques and then reevaluate after, you're going to find them both then moving in synchrony. And also, what would help that is when we work on the occipital base, releasing that one, and then working the sacrum. Yeah, they work together. You know, tongue tied there. Yeah,
Gotcha. And then also when you release things in between, like the
yeah.
thoracic area or different things in between, that's going to help that flow.
Absolutely, absolutely. And I forgot to mention that what's in between there is you've got your dural tube, and that is actually the dural tube rock and glide is something we evaluate as well to see the movement that goes all the way through the body. So yeah, there's a lot of even though it's a light touch technique, there is a lot of training for the palpation to feel all these things. It is a lot of training.
Okay, okay. So being a chiropractor, the what comes to mind with that is the cerebrospinal fluid. So do you
Yes.
guys talk about that,
Yeah.
balancing that or moving that, or is that
Yeah.
part of it or no?
Well, this cerebral spinal fluid is part of the craniosacral system, along with the bones and the surrounding areas, and the movement of flexion and extension comes from the flow of the cerebral spinal fluid.
Okay.
And yeah, and when we evaluate the movement of the bones, there's an area where there's not much movement, that does tell us that the flow is not, it's not doing the best it can be. It's just the way the body's showing us that, oh, this part of the craniosacral system is not flowing the way it should be. And okay, when we do the techniques afterwards, we evaluate. Then okay, now the restrictions are gone. Then you feel that everything is now flowing. I hope that makes sense.
It does. It does. And so if something, let's say that the sacrum's not moving like it should,
Mhm.
that doesn't necessarily mean the problem's in the sacrum, or does it?
No,
Yeah, so
not
the
at all.
problem could be somewhere else, and then you
Yep.
fix that, and then the flow starts going.
Yes,
Yeah, nice.
exactly.
Okay,
Exactly. Yeah.
nice, nice, nice.
Hmm.
Okay. So how long is a typical craniosacral treatment?
Generally 1 hour treatment.
Okay, so about an hour. Okay,
Right now, where some people like to come for 90 minutes. Some people feel like they feel a little bit, they need more time to ground a little bit.
okay.
Um, but most people come for 60 minutes.
Do
Yeah.
you, is there a time frame to wait after, or can you come like, if somebody wanted to come once a week, or if somebody wanted to come, is it better every couple weeks or once a
Um,
month? Is that
It,
vary? I'm
it,
sure it
it
varies.
depends on the situation. If somebody comes in and it's general maintenance, they don't have a specific injury that they're coming in for, then they will come anything between once every 2 weeks or once a month even. If there's nothing, really pressing. But if you've come and you've had a fall, and then I'll be like, you know what, come back next week. And we do like to say to people, to get the best out of experience in craniosacral therapy, at least try 4 to 6 sessions. So how soon you have them depends on the issue of the person.
Gotcha. Okay. Okay. So 4 to 6 sessions to see if you get a result, and then you may do
Hmm.
more.
Yeah,
Right, right.
yeah, yeah,
Because what I like to say, so I always say, there's no technique that works 100% of the time. Because if
yeah.
if there were, then you wouldn't need surgeons, you wouldn't need medicine, you
Right.
could just do this one thing. And so that's about right. You have to give it a number of treatments. Is this going to work? And then, okay,
Yeah.
this is working. All right, let's continue. Let's get you through this. And if
Right.
not,
Right.
then we can switch to something else, or what have you. Yeah, yeah, yeah.
Yeah.
You are a teaching assistant
Yes, I am.
with craniosacral therapy with
With,
up.
with the up,
What's the proper? Is it the Upledger Institute?
it is the Upledger Institute International, now they like to be called.
Okay, Upledger Institute International. Okay,
Yes.
and so and you've been with them for like 16 years
Yeah,
in the
I have.
taking classes and
Yep, from the beginning.
And it's all these are all continuing ed classes. You have to be
Yes.
a licensed therapist.
Yes, you
It's not a
have
school.
to, yes, to take cranial one, if I'm right, you have to, yeah, you definitely have to have a certain amount of hands-on anatomy, you know, experience. And we have, oh, when I'm in these classes, we have anything from, massage therapists, we have some osteopaths even come in, dental, hygienists come in, a couple of nurses. So there's quite a lot of different people coming for this work and to learn this work. And there's like a core class level. So you have Cranial One, which teaches you the basics. And teaches you the palpation skills and teaches you what we call the 10-step protocol. And it's your first knowledge of this work. And it's 4 days for this class. And the good thing about it is you're receiving the work for those 4 days as well. So it's
Nice.
not all just lecture, lecture, lecture. You're feeling it. Your body's feeling what these techniques are feeling, which is really an important part of learning. And you're able to help your clients more if you can feel what you're doing, right?
Right.
And so then there's cranial two class, which you would have had to have known the previous work from cranial one instantly. Like you had to have done, I think, 72 sessions of the 10 step before you can go into cranial two.
I'm with
Because
you. Okay.
because now cranial two, they're going to introduce mouth work and more techniques. So you got to know your stuff. And so, yeah, so they're the two basic classes. I say basic, but they're not basic by any means. Oh my gosh, I dropped my thing.
You're
Say that.
good.
Let me say that again. So yeah, cranial two, you're introduced to the mouth work, and they teach you, I guess, the anatomy and everything like that, and why we do it. And then you can apply to be a teaching assistant.
Okay, so you have to
And
go through one and two. But
yes,
now I went online. I went onto the Upledger Institute International website,
yes,
and they had it was like a little chart. They had a little chart of the classes. So
Yes.
there was craniosacral one, but then there were some other classes
Oh yeah,
you could
you said a
take.
little chart. It's not little, is it?
Right, exactly, exactly. And then there was craniosacral 2, and then there was another whole list of classes. But
Yes.
so you don't do you have to take all those classes, or can you take
No.
craniosacral 1 and craniosacral 2?
No, most people they go through the core classes down the middle first, but
Oh, okay.
it just means that if you take Cranial One, oh, you can actually take this too, right?
Okay. Okay.
But Cranial One, Cranial Two, they're the core classes, and then Somato Emotional Release, which because now you've done the mouth work, then a lot more emotional things happen. So now you're learning the Somato Emotional Release to know how to help your clients moving from there, and that's where you really see real cranial work, SER classes, in my opinion and
And
experience.
that's like an advanced course because that's
Yes,
past craniosacral 1 and 2.
yes,
And
that's
then you
right.
get into the
And
somato emotional release. Okay.
yeah, and cranial after you've done cranial two, you can actually apply to for the certification too. And
So
but the
so
thing
there's
is,
a so there's craniosacral 1, craniosacral 2. You can get certified in 1 and 2.
yes, and that's called the techniques certification. And
Technique
that
certification.
and that's based on class CS1 and CS2.
And then you can go further into the somato emotional release.
Yes.
But that's in addition to, you can't start there.
Nope, you
Yeah,
cannot
okay.
start there.
Okay.
Yeah, you cannot start there.
And then are
Yeah.
there more than one of the somato emotional
Yep,
release
there's
classes?
two.
Okay, so there's one and
Yeah,
two
there's
of that.
yep,
And
yep.
so and these again, these are just the core. These are just the
These
core.
are these are the yeah, these are like the bases, and it's just I'm these classes are just amazing. I mean I've taken quite a few of the classes that are outside of those. They have the immune classes, the brain classes for cranial work, pediatrics. If you're a nurse and work with infants, then you want to use cranial sacral therapy with your babies, then
Right.
yeah, you do cranial one, cranial two, and then you'll get access to that side and how to integrate cranial work with what you're already doing.
Now, are all the classes 4 days, or are some of them 2 days, or
They most of them are 4 days.
most of them are four? Okay.
I don't think I've yet to take one that's less than 4 days.
Are they
Um,
Thursday, Friday, Saturday, Sunday?
yes, yes,
Generally. Okay.
yeah,
Okay.
yeah, yeah.
Are they all live in person?
In person, yes, they are.
All of them are in person.
They do have some. When 2020 happened, everybody went online.
Right.
Right? And you know what? I have to say the Institute did a wonderful job of making that happen. And, because there's been instructors that have been doing this for so many years, and then all of a sudden they got to put everything on a computer. They may not have been used to work, and all that transferring and
Exactly.
everything. They did a really good job coping with that. And so they do still offer some things in person. I mean, online, but they are in person, and they are teaching in over 625 countries right now, which is wonderful.
Yeah, that's
Yeah.
amazing. That's amazing.
Hmm.
And there is something about the in-person class versus the live webinar class.
Yes,
They're different. They are. So because
they are.
they are. Yes. I do some live webinars still, but the in-person is just it's better.
It
There's
is.
something
It
about it.
is.
Yes,
Yeah,
for sure.
absolutely. I agree.
To become a teaching assistant,
Hmm.
and then to become an instructor, there's actually a process. It's not like,
Yes.
hey, I took cranial 1 and 2, I'm ready.
No, there's a
There's a
there, that's why I'm taking my sweet time with it.
so because they make sure that if you're an instructor that you're going to
Yes,
go out and do what they want you to do.
exactly.
They want it
Exactly.
done a certain way, right?
Yeah, they wanted to keep Dr. John's work alive in the right way. Absolutely.
Right. That's
Yeah,
good. That's good. I
yeah.
love that.
That's
I love that
they're
process.
very strong about that.
Yeah.
Hmm.
So it's not a short, easy trip to
Oh,
get there. You got to go
and
through some.
yeah, I mean, for instance, I see if I can remember all of them. You have to have done certification for techniques. That's the first one. And then the second certification for diplomate, which is what I am, because the diplomate certification is based on SCR 1 and 2.
Okay.
Somato emotional release 1 and 2.
Okay.
And take the advanced course. And what else is there? You have to be a certified teaching assistant, which I am. And that took a while because I didn't start TAing till later on after I did my first certification. And to be a certified teaching assistant, you have to have assisted in 4 Cranial 1 classes, 4 Cranial 2 classes, 2 SCR 1 classes, 1 SCR 2 classes, and participated in a pediatric class. I think I got that right. My memory's right. And that's just to be certified. And that's just one thing on the list for teaching.
Right, right.
Right.
Wow.
Um, so I'm going down my list. Where am I at now? I'm about to do advanced free class. No, advanced two. And advanced two classes are really more about the therapist. And you have multiple hands working on you. So you might be in a group with 4 other therapists and you're on the table and you're working because there's a lot of more deeper emotional things that may come up, but it helps us, process things that our bodies need to at a deeper level, which then helps our clients do the same. And so that's next on my list this year. I'm taking, and then a presentation class I'm going to take as well, so I can get a bit better at speaking. I'm learning.
So
Um,
they have a class where you have to present in front
yep,
of.
they have a
Wow,
presentation class.
they've really got this set up nice.
Yes, they have a
Yeah.
presentation class. Absolutely.
Oh, that's
So
awesome. Yeah.
yeah,
That's awesome.
because
I
that
I
would help me with confidence.
that's you do good. You
Oh,
do
thank you,
good.
thank you. Mm.
What are if we were to go through, like, you've used this work for a long time. You've been in a lot of classes. I'm sure you've heard stories of what other people have helped with and stories that you've helped with, but
No,
some conditions that people come in with. If somebody was watching this and go, "Hey, I have that. I didn't know it helped with that." What are some things that, that
okay.
craniosacral does pretty good with?
I would say chronic fatigue, chronic neck and back pain, sciatica pain, TMJ issues. A lot of babies coming for tongue tie
Wow.
from birthing issues and other things too. And what else could I say there? Oh, people that have had concussion. There is a class for concussion too, which is excellent, excellent. Um, but I will say you can't come straight in if you've just had a concussion. You need to wait. You do need to wait. Let's say the recovery of a concussion, you definitely need to wait at least, if not 6 months, then at least a few months with a doctor's, approval.
Okay.
Um, what else is there? Fibromyalgia. There's such a wide range of things, and that's why we have a forum on social media for therapists, and some people come along and say, "Well, is can it heal this and can it heal that?" And we're always saying, "Well, we give conditions that it can help, but we're not to say it's for one thing. It is for the
Right,
whole body.
exactly. Yeah,
It's
and you can't
yeah,
guarantee, you can't say, "Oh yeah,
exactly.
this will help." Yeah, 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 because
Every,
every person's different.
yeah, everybody's completely different.
Right.
I had a
Right.
lady with vertigo, and I helped her tremendously, but another person wasn't that helpful for them, and it's like, hey,
That's
um,
it. Yeah. That's
yeah,
I think that's why they always say that we're in practice, right? And
yes,
that's what they always say.
yes,
All right, I want to brag on you for a second because you were the pilot therapist in Heal It Forward program.
yes.
Is that correct? And that's with the Upledger Institute International. That was something they put together.
Yeah, that was with the foundation,
With the foundation.
and because I have a foundation. I didn't say that right, but I'll get it right. I'll give you the info to add on later.
Okay.
And it's the John Matthew Foundation, if I'm right, so the Upledger. And basically, it was an offering for people to try craniosacral therapy that did not have the means or financial means to try it.
And
And yeah.
I saw that this was in 2020. So was this prior to
No,
the
this was
pandemic?
actually this was towards the summer because that's when I first started working in the clinic there that they had, and and then that's where I did that. So it was around June 2020.
Okay. So we were just a lot of places
Kind
were
of,
still shut down. Florida
yeah,
wasn't. Yeah. So
yeah,
Florida was, yeah, yeah, yeah. Okay.
yeah. There were a lot of precautions, but we were kind of loosening up a little bit by that point. So a lot of people were having a lot of stress and a lot of restrictions and a lot of, and I was able to find, I want to say find, I wasn't searching, but I would just be, I don't know, grocery shopping, and someone would see me in my scrubs and they were like, "Oh, what do you do?" And I'm like, "Oh, I'm a craniosacral therapist." And a lovely young lady was just like, "Oh, I think that's something that I need." I'm like, I, and this person was a student and she was stressed because of the climate and financially, and she didn't have a doctor. There was this whole thing she was telling me, and I'm sitting there thinking, wow, I think she's my first client for for the program. So then what they have to do is they send an email to the institute, and there's a form to be filled in, and to see if you fit if you meet the requirements for the program, and then they would be booked in for a session. And we just seen where it was going, and it ended up being each person could have 4 sessions, because it takes sometimes longer, for them
Right.
to get help. And it was amazing. I was just felt so honored to be able to offer that to people. And I had a friend who had a brother, and he was early Alzheimer's, and he wasn't living local or anything, whatever. But she was just so down about, I don't know what to do for him. I don't know. But I said, well, I think I have something for you. And he came, and she said to me, "Oh my gosh," she woke up the next day, and he said he was dreaming about things he'd never remembered in a long time, just out of the blue. And he was
Nice.
singing and he was laughing. And stories like that was just really nice to hear that you at least, I can't cure Alzheimer's, but I've been able to help in some way. So that
Those are,
was really
yeah,
nice.
those are
Yeah.
unbelievable. Those are nice stories. Yes.
Yeah, yeah, yeah. So yes, I was happy to do that. And so from then it was just a pilot program, and then other people in other areas, other countries would then adopt that in their practices and offer the Heal It Forward program.
And so is that still going on?
As far as I know, it is still going on.
Okay.
Yeah,
Oh, nice. That's very
yeah.
nice.
So
That's
other
very nice.
therapists can contact the institute and say, "Hey, I would like to participate with this in my practice," and then they work it out between them and the institute, and then they able to offer it some sessions to some clients too that are in need.
Oh, that's nice. That's
Yeah.
nice. And then, so then we fast forward, we come up into 2025, so this year,
Yes.
and you were appointed the supervisor for the cancer therapy support program.
Yes.
So tell me
Yeah.
about that. Tell me.
Oh, yeah. I was asked to do that earlier this year, and I was like, yeah, why not?
Yeah.
I mean, sure. They this program has already been running for quite a while, actually, quite a few years.
Okay.
Um, but this year they asked me to continue it, and I said, "Yep, absolutely. Yeah, the people need this work." And it is interesting because with cancer, I have an uncle that lives here in Florida that I only knew when I came here. I met when I came here, and at that time, his wife she was dying, from cancer, breast cancer, and I remember talking to her in the hospital, and I was telling her, "Oh, I'm about to start this class." We were just making conversation, and I was like, I was about to start cranial. I said, "Yeah, I'm starting a new class called CranioSacral Therapy, and I'm really excited for it." And she knew about it, and she said, "CranioSacral Therapy?" I said, "Yeah." She said, "That's helped me." I was like, "Wow." So I think in the past, craniosacral therapy has been offered to breast cancer survivors, or people undergoing breast cancer treatment. So
Okay.
she knew. I'm surprised she knew about it because my uncle was not a holistic person at all. Like, he's very old school. So when she said, "Oh," because I know what that is, it helped. She said it helped me a lot, and that's actually the last time I saw her. So she
Wow.
told me that, and I hadn't started the class yet.
Wow. Wow.
Yeah, yeah,
So now
yeah.
is it offered at the institute?
Well, they have, because it's really it's more of a classroom opportunity for therapists
Okay.
to practice on people that with different ailments. That's really the idea, rather than it being my office type of, So it's like a group session. They have their own classroom there, and we generally have maybe 5 to 6 clients at a time, and each one has a therapist, each, sometimes more, depending on who volunteers. And the therapists all volunteer their work. They all volunteer to come in and help these clients that are undergoing treatment for cancer.
So
And
it's almost like a class with the is that or is it just a
I,
classroom?
I don't. It's a classroom.
Okay.
It's the
Okay.
classroom. It's they're not being, because everyone there knows the at least
What
cranial
they're
one, cranial
doing.
two.
Yeah. Okay.
They know what they're doing, and that's why I'm supervising. And so if I do see, maybe a client is having an emotional time, then I can just hop on and assist and make sure everyone's, yeah. So I supervise, but I also work on them as well. But make sure that everyone in the room is okay. um, but yeah, oh, again.
That's
All
good.
right.
Is that a phone?
Yeah, you know what? I got my laptop here. I got my
It,
iPad here, and my phone was better.
yeah,
The,
your
the
phone,
picture,
it's coming through so clear. Yeah.
I was like, leave that alone. I
That's
just took the
right.
wire out. I just kept moving the wire.
That's right.
Um, yeah. So the cancer program, I'm really happy to be doing it. And my own mother had cancer, and she passed away in 2005. And she had T-cell type leukemia, and yeah, so it's something I'm happy to be able to pay back a little bit. And even recently, a year ago, my great uncle, he passed from prostate cancer. That was in the UK. And I've got another close family member dealing with that now. And my uncle passed 2 weeks ago in the UK as well. So
Oh,
this,
I'm
yeah,
sorry.
it's
Yeah.
so me getting up and offering this, it's for them, and it's something I can do in this world. That's all I can say, about
That's
that.
yeah, and that's giving
Yeah,
back, truly giving
yeah,
back. And yes,
yeah, yeah,
nice, nice.
yeah, yeah,
So for you personally, the next number of years, I know that
yeah.
you one of your goals is to become an instructor
Yes.
in that, but that could be what's the timeline? What do you think the timeline?
It's, you know, I mean, really, as soon as you've checked off all your boxes and what you need to be, then you can say, "Hey, I'm ready," and wait to see what comes next. And again, I'm not hurrying. There's a bit of fear there. There's a bit of fear.
I
But,
find it's better just to jump in. Just jump in and do it, you know?
but it is, but it is, like you say, I do enjoy talking about this work. I do love this work. I love assisting in the classes. I'll be doing this for a long time.
Well, I
Um,
think I just met you, but I think that you would be a phenomenal instructor.
oh,
You're very
thank you,
good at explaining things. You're very easy to talk with, and so I think you would make a class very interesting and very fun. And
thank
so
you.
I think you need to go for that a little sooner.
Okay, all right.
So,
Yeah.
now, and then you have your clinic. You have your clinic.
Yes, I am based in West Palm Beach, and my office is just off Palm Beach Lakes Boulevard, which is right near the big shopping outlet. And it is within a business office, and I just made a beautiful therapy room out of it. And it's right next to I-95, so it's very easy to get to as well. I have some clients that come from Miami for craniosacral therapy, and then I have some people come north in Okeechobee that come too. And yeah, people travel for this, and people do the research when they're looking for craniosacral therapists. I know there are several types of craniosacral therapy out there, but quite a lot of mine, they specifically look for Upledger craniosacral therapists, and they do search and they do come. Absolutely.
That's very good. That's very
Yeah.
good. Now, was Upledger, would you say he was one of the first with craniosacral work, or because I mean,
He,
I just when I got into healthcare in the 90s, he was huge, you know.
yeah.
And I'm in chiropractic, and
Yeah.
I knew of him, so I was like, man, this guy's been around,
Yeah.
and so I'm thinking he was
He,
one of the
he
originals.
he discovered craniosacral therapy. He coined
Yeah,
it
there we
craniosacral
go.
therapy.
There we go.
He
So that's
did.
from him.
Um,
And so then there's
mhm.
offshoots
Yes,
basically from his
absolutely.
work. Yeah.
Yep. Yeah.
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 Okay. Oh, very good.
Yeah, so yeah, I feel privileged to have worked in the clinic that they had at the institute there, because that was his clinic, and the room I was working from was his Dr. John's actual room. That was his therapy room that I was working in. So
So did you get to meet him?
I did not. No,
Oh,
I
you
did
did not.
not.
Okay. So that was after
No, that was before. Yeah, yeah, I did not get to meet him.
you came in after. Okay. Okay.
Yeah,
Still, that's nice.
yeah,
That's nice.
yeah, yeah. And people did travel across the world to come there
It-
specifically. Yeah.
wow.
And they still do come.
Exactly. Well, it's
Yeah.
still huge. It's still
Yeah.
he did a great job setting it up so that it would continue.
Yes.
He did a
Yes.
great job of that. Yeah.
And
And then
yeah.
um they're getting good people like yourself,
Yeah.
and then they're putting you through the process of,
Hmm.
no, this is how we're going to do it so that they can
Yeah.
continue the legacy. So I think they've set
Yes.
things up very,
They
very
have, they have.
nicely. Yeah.
So if you ever see an ad saying be certified in craniosacral therapy in a 2-day course, that's not Upledger craniosacral
That's
therapy.
not
I
up
tell you
ledger.
that right now. I've seen them and I'm like, oh no, this is not good.
Right.
So go to the Upledger and get on a class. And even if you think it's a bit pricey, they have a really good payment system. They don't charge interest. They're very, very good financially with that kind of thing. And you can pay for like the core. You can sign up for the core classes, Cranial 1 to SCR 1 and SCR 2, and be signed up for that and pay monthly towards it. And then if later on you wanted to change a class or something, they're very flexible with, you know what, I'm going to take this class instead. Or your money's still there. They're very, very good. And I really love that they do that, because if not, there may be less people wanting to learn it. You know what I mean?
Exactly.
That may not be able to. So yeah, Go to the Upledger if you want to learn this work. That is what I'm saying
It
to everybody out there.
it seems like they're in it for teaching the people, teaching, and this is what we
Yes,
want, and making sure that what they teach is
yes,
the right way, teaching them the right way.
exactly,
Yeah, keeping the
exactly.
core standards, which is
Yeah, yeah,
important, which is important.
yes, it really is.
So,
Yeah,
well, very good. I learned a lot. That was
yeah,
good.
good,
That was
good.
good. So, well, I really appreciate having you on. I like I said, I got a lot out of this, and maybe we'll do another one in the future.
Okay, it sounds good. Thank you so much for having me. And despite my nervousness, I really enjoyed it too.
Oh,
So,
good, good. That's good. If you made it this far, smile.